SNAP is a lifeline for 42 million Americans, or at least it was before its budget was slashed by the Trump administration. I'm Dr. Vin Gupta, a public health physician who you may recognize from my role on cable TV as a medical analyst. I'm teaming up with Courier News to go beyond the headlines and the statistics to talk to real Americans whose lives have been turned upside down by our broken healthcare system. This is The Diagnosis. This summer, President Trump signed into law a bill that cut $120 billion from SNAP benefits, cuts that were made by Republicans in Congress in order to pay for more tax cuts for the wealthiest Americans, essentially taking food from the poor to give more tax cuts to the rich. Again, about 42 million Americans rely on SNAP benefits to feed their families every year, with 80% of these families having a child, a disabled person, or an elderly adult in their household. That number is growing today, with the price of groceries on the rise, and with it, rising food insecurity. I spoke with Anthony Bonner, a barber who lives in Tennessee and relies on SNAP to feed himself and his 13-year-old son.
You know, with the rising cost of groceries, even now, like I've noticed just since July, really, that foods that I was typically getting under my SNAP benefits, I've been had SNAP for a little bit over a year now. I'm seeing like just in the last two grocery shops, my last two grocery trips, where the same list. Take the same list, and I'm not even able to afford some of the same things.
This is not just anecdotal. Recent government data shows an uptick in the wholesale price of vegetables. The price supermarkets pay for fresh veggies rose by 39% in July. SNAP has helped reduce food insecurity and make healthier options more affordable for American families.
Since having SNAP benefits, I was able to not only, go after brands that we know and we like, but then I also was able to, like, choose healthier options, buy things more in bulk so things will last longer. I was able to provide my children snacks, to have in between the meals. And so it just it was a huge break on the family as far as just like, what we ate, how we ate, and just the quality of food that we was able to start ingesting.
Can you talk about any stigma that you or others that you know use SNAP feel just around the utilization of this benefit?
Everybody, no matter you're rich or poor, we need to eat. Like nobody can go without eating. So it's just ridiculous that there's any stigmas, but that's like the biggest, that, oh, if you don't work, you don't eat. But I think the biggest stigma that we need to like remove from food is food security, is that it's a privilege. We all, like, that is a right. That is a human right.
It's not just the $120 billion in cuts over the next decade that will make this program less accessible for more Americans in need of food assistance. States could also be hit with a penalty for being too generous for these benefits. The federal government determines that a state has too high of an error rate for its distribution of SNAP benefits. The Trump administration can fine anywhere from 5 to 15% of the benefits, enough to make some states wary of providing those benefits at all.
I just really truly see a scenario where there's going to be people that should be able to qualify, should be able to have them, but the state's just going to tell them, "Oh, well, we don't have it. We can't do it." So then it's like, what happens to those families? What happens to those children? A lot of times these schools are the only meals that their kids get.
As Anthony points out, states may determine they can't even risk the chance of a penalty and wind down SNAP benefits entirely. That will affect him and families like his who rely on SNAP benefits.
The impact I see is very, very important for people, especially in today's society where you have so many people, working two jobs just to be broke.
Sam is a UFCW member, which is a union representing grocery stores across the country. He is worried about what all of this means for customers visiting his stores and the stores themselves.
They need this. They need this to survive. They need this to take care of their children. They need this to have hope. I guess the thing that I always, get really, really sad about is I see so many people that don't even really have any kind of hope because every little assistance that they've had seems to find a way to be taken away.
Do you feel like people are embarrassed when this happens? So they come in, they're trying to buy cereal or something for their children, and they think it's covered to their benefit. They're at the register, and they are informed that it's not covered. I'm wondering what the human impact is there.
a lot of times you can look at the faces. You know, I'm a sympathetic individual. I'm an ambassador of customer service, and I can relate. You know, I haven't been on these type of programs, but I know what it's like when I first started in '91 to work 2 jobs just to be broke. You know, this shouldn't happen to human beings because food is a necessity and it is a right. But you can see how they're humiliated and they feel embarrassed and they feel less than a human being. And we've got to try to find a way to be more transparent and give people hope. I mean, they're just hoping to be able to feed their families. Just hoping to be able to live day to day with the basic needs that we all need when it comes to food. We keep finding ways to cut SNAP assistance. If we keep finding ways to eliminate people for no reason, what is our society going to become?
Dan is right. If our leaders can't or will not pass laws that allow every American access to healthy food options for them and their families, is this the America that we want to live in?